just get that, the milestones as public, and also what definition is available publicly on those milestones.
Happy to take that on notice. Thank you.
All right, thank you. Senator Madigan.
Thank you, Chair. Thank you, Minister, Department. My question pertains to NATA accreditation of laboratories overseas for testing. Is there anybody here who could...
Could you just spell out the acronym for Hansard? So it's not necessarily something we'll be able to deal totally with, but...
National Association of Testing Authorities, NATA accreditation for laboratories.
We may not be able to answer all your questions on this because it's not our space, but Professor Skerritt might be able to help us a little bit.
John Skerritt, Deputy Secretary for Regulatory Services.
Thank you. I understand that Lyme disease literate doctors refer some of the patients to internationally accredited overseas pathology laboratories, but the test results are deemed false positives, as these overseas labs are not NATA accredited. However, I understand that the problem is NATA is no longer resourced to undertake international accreditation, and that though they have applied for membership of the International Laboratory Accreditation Cooperation, ILAC, that could take a year or so to complete. Hence, there is a gap, as there is currently no mechanism for mutual recognition of overseas medical testing. What has the National Pathology Accreditation Advisory Council, MPARC, done to address the current gap in Australia's ability to recognise overseas laboratories?
Senator, I'll just briefly clarify a few issues around NATA. NATA are not part of this portfolio. Indeed, they operate largely on a fee-for-service cost recovery basis, and they are quite deliberately at arm's length from government. What they do have a role, as you have correctly identified, is within Australia in assessing laboratories and performance of laboratories. But on matters Lyme disease, I'd like to pass over to the Chief Medical Officer.
Good morning, Senator. Chris Bagley, Chief Medical Officer, and we also have with me Dr. Gary Lyme, Principal Medical Advisor with the Department of Health. And this issue of Lyme disease and particularly, I think, the issue relating to diagnostic testing and how a sample of blood from one patient can be diagnosed as negative for Lyme disease in one laboratory and positive in another, which is often an overseas laboratory, is one which has been of great interest and concern to us in the department. And Dr. Lyme, I think we are doing work specifically in this area, and I'm wondering if you could speak to that.
Thank you, Professor Bagley. Gary Lyme, Medical Advisor, Office of Health Protection. Senator, I'll answer I'll explain what we're doing in terms of the department, and if you'd like, I can go through some of the background of the National Pathology Accreditation Advisory Committee, its relationship with the National Association of Testing Authorities Australia and the Royal College of Pathologists of Australasia as well. In terms of the reference that Professor Bagley made, we are aware that there have been some concerns about discordance of test results associated with Lyme disease testing in Australia between the accredited medical testing laboratories in Australia and other laboratories. It should be made clear that overseas laboratories, for example, IGeneX in San Diego in the United States, Infecto Lab in Germany, Armin Labs in Germany, they have sought their own certification in their own countries, and I have been told that they are compliant with the international standard on requirements for quality and competence. So from a recognition of their accreditation, there's no argument there. There is one laboratory in Australia that a lot of the patients are interested in. That laboratory has not been successful so far in its assessments for medical testing accreditation, but it is undergoing assessment, and I'm not in a position to comment on whether they will be successful or not. That's business between the National Association of Testing Authorities Australia and the Royal College of Pathologists of Australasia. Because of this discordance that we see in the testing, we have been looking at, or we have contracted the National Serology Reference Laboratory, which has independent expertise in assessing in vitro diagnostic assays. They were originally set up as a laboratory facility that worked very closely with the Therapeutic Goods Administration, and it started its work when human immunodeficiency virus and the acquired immune deficiency syndrome first came on the scene. And since then it has developed expertise not just in testing for HIV, but also the other viral hepatitis. So, for example, hepatitis B virus and hepatitis C virus and some of the others. And its expertise is in the evaluation of diagnostic assays so that from an Australian perspective we can be satisfied of the quality and the safety of testing for those things. So we have contracted with the National Serology Reference Laboratory to undertake an independent evaluation of the diagnostic assays that are being used. We have sought participation from IGeneX in the United States, from Infectolab in Germany, from Armin Labs in Germany, from the Rare and Imported Pathogens Laboratory in Public Health England in the United Kingdom, as well as Australian Biologics, as well as about a handful of Australian accredited medical testing laboratories. What we hope to determine from that evaluation is whether there is any problem with the diagnostic assays themselves in terms of testing done here or overseas. We may also be in a position to examine some of the other differences or problems associated with those assays. Getting back to the issue of the discordance, one of the important things in human pathology testing that's really important to understand, particularly with human serological testing for microbiology, is that serology should rarely be used to make a complete diagnosis. Serology is an adjunctive diagnostic component to a diagnosis of a disease. So, for example, with classical Lyme disease, it's really important that patients have typical symptoms, and when the serology is performed in an area where there's high prevalence, then a positive result is a good indication that you have true disease, and a negative result is a reasonable indication that you don't have the disease. One of the things that we often have difficulty in appreciating outside of pathology circles is that each test has its own sensitivity and specificity, but the predictive value of a diagnostic test is really determined on two things. One is the prevalence of the disease in its truest state, and also in the interpretation. What we know about Lyme disease testing, and that's classical Lyme disease testing in Australia, is that the prevalence of true classical Lyme disease in Australia is low. In fact, it's probably zero. The prevalence in those areas where it's endemic is high. And based on that, if you've got a test with a high specificity, then a negative test here is highly likely to predict true negativity, whereas a positive test is likely to be a false positive. The other important factor is interpretation. I've seen the results from patients who have submitted their specimens overseas to America, to Germany and to other places, and when I look at the results that come back and the interpretation of the results, those interpretations are often at odds with the standardised criteria that are established by large agencies like the Centres for Disease Control and Prevention in the United States, as well as other centres in Europe for communicable diseases. The criteria that are used need to be stringent because they are criteria used not only for surveillance, but they assist with diagnosis. So the disharmony or the discordance that we see in testing is not necessarily unexpected. It's unfortunate, and it's difficult for a lot of patients, and without wanting to sound prejudiced against my other medical colleagues, outside of pathology, it's fairly difficult for people to understand the nuances of diagnostic tests and their value, and that demonstrates the importance of having pathologists in the Australian medical system. When it comes to the background on accreditation, Australia has a really good system of medical testing accreditation based on the international standard 15189. The policy is set by the National Pathology Accreditation Advisory Council, which is made up of jurisdictional representatives, usually pathologists or senior medical laboratory scientists, as well as representatives from the peak bodies involved in medical testing in Australia. They set the standards and the guidelines. They also provide information. They also align themselves with this international standard. The operational arm of this is the National Association of Testing Authorities Australia and the Royal College of Pathologists of Australasia, and that's specifically for the medical testing program, where they do assessments of laboratories, and they usually spend a day in a laboratory doing an assessment, and if a laboratory is successful with their assessment, then they are accredited for medical testing.
Thank you. And could I seek the advice of the department? Under which outcome would you advise the department could answer further questions about Lyme disease and also Q fever?
Outcome 9.
Okay, so you'll have people here who can answer questions about Q fever and Lyme disease at outcome 9?
Yes.
Okay, thank you. Thank you, Chair.
Thank you, Senator Madigan. Senator McClure, Senator Seward, I think, had a follow-up on this.
Oh, no, not on that. I had a separate issue, so I'm happy to do it whenever. So.
Well, then I'll come to you, Senator Seward, then, and then I'll go to back to Senator
Can I
McClure.
check which part of the department's responsible for the Health and Other Services Compensation Act?
Might have to get back to you on that one, Senator.
Okay. Sorry.
Sorry,
Health?
Sorry.
just one moment.
Oh,
Senator Moore, did you have... Sorry, I didn't realise you had a follow-up on
I beg
that.
your pardon. Sorry.
Yeah, okay. Sorry, Dr Lum. Senator Moore had...
No, that's okay. It's very short.
Well, yeah, if it's a quick follow-up, it's probably better we deal with it now.
Rather than come back.
That'll give them a chance to find out.
No worries.
Professor Bagley and Dr Lum, you said that you were doing some specific work in the area. I'm just wanting to clarify whether it's specific work in the general area of diagnostic certainty in relation to the very detailed evidence you gave us, or whether there was specific work being done on Lyme's disease in this process. I wasn't clear. Your answer looked at the whole process across certification across the whole world. I know that we have a shared passion about the Lyme's disease stuff, but is there particular work being done within this field on Lyme's disease?
Yes, Senator. I apologise for not being specific. The work
very
that we've
specific, Dr. Lum.
the work that we've contracted with the National Serology Reference Laboratory is particularly about the in vitro diagnostic assays that are used for the diagnosis of Lyme disease.
Specifically on Lyme. Good. Thank you. Thank you. That was my question.
Has that enabled you a bit of...
We're checking.
Okay, so if you... I've got
What sort of...
a couple of questions about what the process involves and if it's been used, the amount of money that's been reclaimed from Medicare costs, etc. So should I ask them here, or is it better for you to come back and maybe at the end of this session let me know if it's here?
Is it more about the compliance functions of Medicare?
Well, it's under the under the Health and Other Services Compensation Act.
Health and Other Services Compensation Act. All right. Now, it's likely to be more around than an outcome 3 issue. But,
okay.
Yeah, an outcome 3 issue.
Right, I'll leave it till then.
Yeah.
Okay, thank you.
Sorry, Senator Madigan, did you have a follow-up?
Professor Bagley and the other witness, could we just have them back for 1 minute to clarify?
I do apologise. We'll try not to do this again. If people could get attention while witnesses are at the table. Professor Bagley, if you could come back, just a quick follow-up from Senator Madigan.
Dr Lum, thank you, Chair. Dr Lum, with the many problems with pathology that you've just alluded to, what has the department done to educate doctors, for instance, that an EM bullseye, rash is considered pathognomonic. That is a diagnostic sign, I believe, for Lyme disease in the rest of the world. And could you just explain to me very briefly why it was removed from the diagnostic guidelines for Australia instead of educating doctors how to look for it and diagnose it?
Thank you, Senator Madigan. I think you're referring to the guidelines that the department recently released to the medical community in Australia. That was a guideline that was specifically around the diagnosis of Lyme disease in overseas acquired patients. In patients who had acquired Lyme disease overseas. That guideline had originally been drafted by former members of the Chief Medical Officer's Clinical Advisory Committee on Lyme disease, as well as going through the Public Health Laboratory Network and Communicable Disease Network Australia, and was recently endorsed by the Australian Health Protection Principal Committee. That particular guideline does make reference to erythema migrans as a pathognomonic rash that's associated with Lyme disease, and it makes it very clear that that rash and that pathognomonic occurrence is related to areas where the disease is endemic. Given that in Australia we do not have endemic classical Lyme disease, that is, we don't have actual evidence of that, patients who have rash after tick bites, it's very common. Across the eastern seaboard of Australia there are lots of ticks. Ticks contain a significant number of microorganisms, mainly bacteria, but they will also contain viruses and parasites. And so it's not uncommon after a tick bite for there to be a rash. It may in fact be a circular or an annular rash, and in some cases it may look like a bullseye rash, which is said to be pathognomonic for Lyme disease. The problem is that because we are not an established endemic area, it would be inappropriate for medical practitioners in Australia to make that diagnosis. To use pathognomonic signs, to use clinical signs and symptoms to diagnose medical problems really relies on a high pre-test probability, so you need to be in an endemic area or you need to have classical signs and symptoms. In this situation, we don't unfortunately have evidence of high endemicity in Australia, so it makes it really difficult. We really feel for these patients, Senator. I'm in communication with many of them regularly, as well as their doctors, and at the moment it's not clear what their clinical condition is really caused by, but all of the evidence to date from the research that's been done suggests that it is not classical Lyme disease. To date, there has not been found any Borrelia burgdorferi, the causative organism, or any of its very related organisms in Australia. You may be aware of recent research from Professor Peter Irwin, a veterinarian from Murdoch University. He did some work looking at 196 ticks in Australia, plus 30 ticks from Germany, where he readily found Borrelia burgdorferi in the ticks from Germany, but was unable to find it in any of the Australian ticks. What he did find in one tick that was extracted from an echidna on the New South Wales coast was a probable Borrelia species that he thinks is probably in the relapsing fever group, which is very distinct from Lyme disease. But because the sequence that he was able to obtain from his next generation sequencing techniques wasn't long enough, he wasn't able to characterise the organism and provide us with the species name.
And Senator, if I may, just to add, and I also want to acknowledge all those who have been diagnosed with Lyme disease in Australia, a number of whom have contacted Dr. Lum and me, and we continue to spend a lot of time trying to work through the varying elements of the diagnosis and the treatment, and that's really important. The erythema migrans that you describe as being sort of, if you like, pathognomonic of Lyme disease, it is not. It occurs with a whole range of diseases, so it's not as if you find that equals Lyme disease, and that's important to understand. So it can be part of the picture. One of the things that I do, and on an annual basis, and in fact as recently as the 20th of August, I provide a progress report on Lyme disease in Australia as a letter on what we're doing about this a letter to the AMA, the relevant colleges, whole range of GP organisation, the chief health officers, and the Clinical Advisory Committee on Lyme disease, which I established to provide advice for this, which includes representation from the Lyme Disease Association of Australia, the Carl McManus Foundation, and so on. And there we give them an update as to what's happening with the evidence, what's happening with diagnostic tests. But we also I continue to be keen to ensure, to work to try to get Australian doctors who are treating people who've come from overseas, who've had a tick bite in one of those areas in Europe or the US, to take the potential diagnosis for them for Lyme disease very seriously. And too often we hear of stories that members of the medical profession might just don't include that in their diagnostic thinking, and we keep coming back to that.
If I could add, Senator, one of the things I forgot to mention in my earlier answer to your question was that in terms of medical testing laboratories in Australia who see patients who have acquired classical Lyme disease in endemic areas, they are able to readily diagnose the disease using standard serological tests. So we have a situation in Australia where there are many Australians who say that they have never been overseas, who have non-specific symptoms, who they have looked at the internet and they have seen a whole range of people where they are saying that they have Lyme disease. They initially see a general practitioner, they organise for a test to be done in Australia, it often comes back as negative, they then organise to have testing done in the United States which comes back positive. That's the usual scenario. For those patients who are either, for example, people from Maine, Connecticut, or from other areas in the northeast of the United States, or from the Black Forest of Germany, who have been bitten by a tick and then travel to Australia to visit Australia, they go and see a general practitioner, they have a blood test done, and we get a positive diagnosis. The same is true for Australians travelling to those areas, coming back with a rash, feeling unwell. Lyme disease is considered because they are in an endemic area, and a diagnosis is readily made in an Australian accredited medical testing laboratory.
Dr. Lum, Professor Bagley, look, I was only speaking to a constituent this morning who believes they suffer from Lyme disease, has gone through the testing, and went to a doctor. The doctor was treating them, believed that they had the Lyme disease. Now this doctor has is unable to treat them for some reason. These people are suffering, and how long is it going to take before the government addresses these people's concerns? And there's, I've had numerous people come to me in my home state of Victoria with this sickness, claiming they have it. They're suffering, and they just don't see that anything is being done to address that. And the fact that they've been treated by some doctors for Lyme disease, and then these doctors are told by some professional bodies to back off or harassed. And these people are sick. It's debilitating for them. Very motivated people who, running their own businesses, whose lives have been turned upside down, that of their families. I mean, whilst there's an ongoing discourse argument by professionals on whatever side of the argument, these people are suffering, and this, quite frankly, is not good enough. So what I'm asking for is, when do you think that, you will resolve it, or these people's illness will be treated?
Senator, thoroughly agree with you that there are a significant number of people out there who are quite unwell, and they come from all walks of life, and we have communicated with many of them, and Dr. Lum in particular spends many hours talking with them, and much of his time is taken up with Lyme disease. He didn't indicate, not only is he principal medical advisor in the Department of Health, he is a specialist pathologist and still works as such at the Canberra Hospital. So, and a significant amount of his time is taken up with Lyme disease. And the one thing that keeps Gary and I in particular continue to be focused on this amongst all the diseases and illnesses and issues there are in Australia is that for those patients who you speak to, who we speak to, because there's a lot of patients who are unwell, and many of them have been given the diagnosis of Lyme disease, many on the basis of overseas laboratory testing. It's why I formed a clinical advisory committee on Lyme disease, which had people from the whole range of spectrum, the whole spectrum of interests, of opinions, of involvement with Lyme disease to provide advice, and we got to a certain stage and we're continuing to follow through many of these, the issues that are there. The issue of doctors being warned off and is one that is particularly interesting, and it's one that I've spoken with on a number of occasions with the Chief Exec of APRA, Martin Fletcher. And I think it's important because just recently I discussed with him this issue of Lyme disease, and I've discussed this with him over the years. Does the medical board have a particular issue about Lyme disease or doctors that diagnose it? And I think it's very important that I make it clear their viewpoint. As he pointed out to me just on Monday, the role of the Medical Board of Australia is to protect the public, and the board only imposes conditions on the practitioner's registration to keep the public safe. The Medical Board of Australia does not set clinical standards or adjudicate on the treatment of specific conditions. The board does not have a position on Lyme disease in Australia or any disease or treatment regime. The board expects medical practitioners to work within their level of competence, training and experience to comply with all relevant laws and with its code of conduct, good medical practice. And the conditions imposed on the registration of any individual medical practitioner are always specific to that practitioner. They do not reflect a board view about any disease state or treatment regime. And that's been a constant position. The board does not have a position on Lyme disease. It does not have a position on doctors who diagnose or treat with Lyme disease. Now, all doctors, of course, have to be accountable for the treatments of their patients. And I understand there was one doctor in Queensland who was the subject of a complaint by another doctor in a senior role in the hospital about their treatments. And of course we do know that some of the treatments of people with Lyme disease, have been diagnosed with Lyme disease, can be very intensive and extensive, involve intravenous antibiotics and sometimes for years. So, and you need to be able to make those sort of treatments on the basis of good evidence, and all doctors are called to account there. But Senator, and the other point of this is that we are putting in a lot of time and work and effort. The work, and we liaise closely with Professor Peter Irwin in Murdoch, who is doing, I think, the key research right now in this country in relation to ticks, and he's doing further research which we're anticipating eagerly. And he's found that there are lots of bugs in ticks, and he's found a new one. Now, whether anything he finds there is associated with our own version of a disease caused by ticks, we've still got to work through. And it can be frustrating that it takes time to do that, but that's the nature of research. The Carl McManus Foundation, and we worked with and liaise with and talk with Mila McManus, who's just a champion in relation to this at the University of Sydney's Tick Diseases Unit. And they're doing research, and as soon as they've got research results, we want to find it and make sure that the entire medical community is fully aware of it. So we're particularly interested in this disease. We are particularly concerned about the plight of people who suffer from a disease which has been diagnosed as Lyme disease, because many of them have very difficult and miserable lives. And Senator, you know, when will we have the answer? Well, I think it would have been dead easy if we'd been able to find, say, that Borrelia burgdorferi bacterium that we know is there and readily found by our laboratories and our researchers when they've got overseas tick samples, or when they've got samples of blood and do serology testing from people who've been overseas. We just haven't found it yet, and that's frustrating in this country, but it's not for want of endeavour or effort or trying.
Could you clarify one thing for me, Professor Bagley? Is the department, you said, is aware of claims of bullying, let's say, of some doctors out there treating people?
No, we were aware of a particular doctor in Queensland who was subject of a medical board investigation and involvement with his treatment, and I think, as I understand it, and Dr. Lum will correct me if I've got any elements wrong, he was required in future, when diagnosing Lyme disease, to have that diagnosis verified by an infectious diseases specialist in Australia.
And what do you say to people, what does the department's position to people in the community who have been diagnosed by some doctors in the community that they have Lyme disease, who are treating them, that their symptoms they've got far better, you know, the symptoms have reduced markedly, and then the doctors have said, I can't treat you because I've been told to back off, not to treat you such a way. Like, how do you answer those people who are now gone from back to as bad as they were and as sick as they were, with continuing migraine, headaches, bleeding, etc.? Like, that doesn't help them. If they're getting better, why is it that their doctor can't treat them?
Well, there's no reason, Senator, their doctor can't treat them. And exactly who's telling them they can or they can't, I don't know. It's certainly not coming from the medical board. We liaise with the presidents of colleges. And for many of the people in senior places, they keep an open mind. Not many that believe we have Borrelia burgdorferi in this country, but there could be other causative organisms. So the department wouldn't condone any bullying of one doctor with another, but we're not involved in that setting. The medical board doesn't provide implied or other threats, and you've just heard the view there of the chief exec of APRA. I think that'd be a matter, if they're concerned, they should talk to their relevant college or their own medical board, but it's certainly nothing that comes from us or the medical board, Senator.
Thank you, Chair.
Thank you. Now, we are due to move on.